The Journal of Inflammation Research 2018 is actually condoning what we call a fecal transplant. And what that means is when there's dysbiosis, when there's the imbalance of pathogens and good bacteria and bad bacteria in your gut from taking antibiotics, stressful life, too much coffee, too much sugar, maybe some genetic predispositions, certainly there's some food sensitivities involved. And what they're saying is that the research that they're doing is they're finding people who have a healthy microbiome, and what they do is they take some of their stool and then they share that with a person who doesn't have a healthy microbiome, and the good guys in that healthy microbiome are implanted a fecal microbiome implant into the person who's sick. And that person who's sick notices that they feel better with that healthy bacteria from someone who's healthy. And I know that it's very supportive and a good approach, because about 5 years ago I had my first patient who had that fecal transplant from a person with a healthy microbiome into hers because she was super sick. You've heard of C. diff. She had a hard time getting over that until she had the fecal transplant. And what that did was it put good bacteria into her gut. Now, when she came into me, this was already done, established. And she said, Dr. Osterhout, this did help me out, but I still have these issues. Of course, even though you had a healthy intervention and that technology, she still needs to address her food sensitivities, her nutritional deficiencies. We still have to work on that imbalance of fungus, that candida or candidiasis. We still have to work on healing her immune system, her overall constitution. But that's just one of the explanations to we need a healthy microbiome. And so that technology is being used more and more in hospitals. Take the good bacteria from somebody and share it with someone who doesn't have that good bacteria.